Hi everyone, this is Dr. Priyanka Mehta, and today I am going to talk to you about something which is not spoken about too much, but it is such an important topic. Let's talk about postpartum depression and baby blues. So, postpartum depression or postnatal depression, as some people call it, this is something which is very real. And what happens is, when a woman gives birth, she is expected to always be very happy, very chirpy. You become a mother. This is such a unique experience. Only you can do it. It's been amazing. So they're expected to be happy and excited and chirpy all the time. Whereas giving birth itself is a very exhaustive process. Whether you have had a vaginal birth or whether you've had a cesarean delivery, the initial few days, few weeks, and sometimes even months and years can really change a lot of things in your life. So postpartum depression, or let us first talk about the baby blues. So we need to understand that these are real. These are two different and separate entities. And if you tell somebody that you are feeling very low and depressed, they would probably tell you, okay, you'll be fine, you should be feeling happy all the time, otherwise you will not be able to feed your baby and you should just sleep it off, or there could be different kind of advice that you get. So let me first talk about baby blues. So baby blues is something which is more common. In fact, almost 70 to 80% of women sometimes can get this kind of a feeling where they are just feeling low, and it usually starts 2 or 3 days after childbirth, but by 2 to 3 weeks the baby blues, or the kind of feeling of feeling low, it gets over, and it is also not present all the time. And most of the moms, because of the anxiety and how I will be able to cope and how I will be able to take care of the baby, this can happen, and usually it settles down in 2-3 weeks time. But postpartum depression or postnatal depression is a more serious illness. It is a mood disorder. It is a serious mental illness, and sometimes we are not even able to pick up that a lady or a woman who has given birth recently, a new mom, is actually suffering from postpartum depression. So this is a mood disorder, and it can start even just before childbirth, or even up to 4 weeks later, or even up to a year later. Moms can just develop this postpartum depression. How can we pick this up? So if you're someone who was either given birth recently, or if you know someone who was given birth recently, or you feel that your partner or your friend or somebody who has given birth recently is going through cycles of feelings, basically more commonly what they feel is sometimes they feel totally disconnected or disinterested. They may be feeling sad all the time, they may be tearful, they may just feel very angry, there could be feelings of guilt, there could just be feeling of this lethargy or tiredness, and feeling very low and depressed most of the time. Sometimes it can just be there for 2 to 3 weeks continuously, and if that is what is happening, and there is also lack of sleep, or there is oversleep, not being interested in the baby, kind of disconnected and disinterested, this could be a sign and symptom of postpartum depression, and definitely it needs some kind of a professional counseling and treatment. There are certain risk factors to postpartum depression, such as if there has been a previous history of postpartum depression, suppose the second pregnancy, and there has been a postpartum depression in the previous pregnancy, there is up to a 50% risk of recurrence. Sometimes a family history of a postnatal depression in the mom or somebody else in the family could also trigger off a postnatal depression episode. Many times it just is there that because of the changing hormones, lack of social support, or if you are there are too many things to handle, sometimes also added factors like there is nobody else to take care of the baby, you have had a very serious problem during your childbirth, and you're also suffering from vitamin deficiencies and anemia, and more commonly because of the sudden withdrawal of the hormones in childbirth, especially estrogen hormone, this can just trigger the postpartum depression. So once we have these risk factors in hand and we think that there is something which is bothering you and you're feeling low all the time, it is so important that you seek professional help. And treatment for postpartum depression is definitely available. Initially, when you would be meeting your doctor, and they would probably be referring you to either a psychologist or a psychiatrist, so that we're able to understand your symptoms better. There are different forms of treatment and therapy available. Initially, they start off with what is called as a counseling and a detailed analysis of what is your problem. Sometimes interpersonal therapy, a one-to-one conversation, and you are able to, just sharing your stories, sharing how you feel, what has happened, what is it that is going on through your mind. Even just laying bare what is going through your mind sometimes goes a long way in helping you treat and helping you find a solution to how you are feeling. There are also medicines available. Different kind of medications are there which are given on the prescription of your doctor, depending on your symptoms and how serious it is. And these medications do help if you are having this chronic low mood disorder, and that will be analyzed when you meet your healthcare provider. So do take care, and do understand that if you have given birth recently, if you are going through these feelings of anger, guilt, tiredness, disconnect, lethargy, not feeling up to it, always having these, you're continuously thinking that you're not a good enough mother, how will you manage things, and if these thoughts are becoming so overwhelming that they are affecting your day-to-day life, do reach out and seek help